Contrary to what people think, kidney diseases in children is quite prevalent in the population, and these children should be seen by a pediatric nephrologist. Hello all, I am Dr. Shweta Priyadarshini. I am a pediatric nephrologist at Apollo Hospital, Jubilee Hills in Hyderabad. So, like I said, that renal diseases are quite prevalent in children and they should be given its due importance. Basically, so many times renal diseases, they present very silently. So by the time they are diagnosed, it's already very late and critical damage has happened to the kidneys. So attention should be paid, to any renal symptoms, and this should be brought to the notice of the pediatrician and then the pediatric nephrologist. Another important point that I would want to highlight is that children are not many adults. They should be seen by a pediatric nephrologist. Just like a child with cough, cold and fever goes to a pediatrician, a child with renal issues should go to a pediatric nephrologist. The training background and the experience of the pediatric nephrologists makes them capable of addressing the renal diseases in children while paying attention to the growth requirement and various other psychological aspects as well of the family which takes care of these children. So it is very important that children with renal diseases should be seen by pediatric nephrologists. So renal diseases in children can present in many ways. It has varied manifestations. The manifestations can begin right in utero while the mother is pregnant with the child. In pregnancy, while the mother is carrying the baby, the child can present with hydronephrosis or the swelling of the kidneys as in common language. Child can have cysts in kidneys. Kidneys can be placed ectopically or in a different location. The size of the kidneys may be small or the kidneys may be fused. There's a common entity called posterior urethral valve seen in male babies that may be present, that may be picked up in uterus, and many a times these problems needs to be managed surgically as well after the birth of the baby. So hence the importance of antenatal screening and antenatal scanning of for the renal anomalies is highlighted. So another very common disease in children is nephrotic syndrome, wherein the child presents with edema or the swelling of the body. The child will have decreased urine output. So 80% of the children with nephrotic syndrome can be treated with steroids, which is the first line of therapy for childhood nephrotic syndrome. So a child with nephrotic syndrome presents with edema, that is swelling of the body. It generally starts at early morning periorbital puffiness or puffiness around the eyes, and then it progresses to the entire body. Simultaneously, the child will have low urine output, oliguria, decreased urine output, and while this is not a very good sight for the parents, what has to be kept in mind that this is a treatable disease. This is one of the treatable childhood renal diseases. Also, the growing needs of children, the needs of the growing children, I should put it like that. The needs of the growing children is different from an adult, and hence the pediatrician, the pediatric nephrologist is more tuned to those needs, and hence children with renal diseases should go to a pediatric nephrologist.